Speaking of Gaza, Israeli forces are accused of killing and wounding dozens of Palestinians who were waiting yesterday for humanitarian aid. The World Food Program, a United Nations agency, said its convoy of 25 trucks was attacked by Israeli tanks, snipers, and other gunfire in the northern Gaza Strip. The agency says the shooting came despite assurances from Israeli authorities that conditions for humanitarian operations would improve, including the removal of armed forces along convoy routes. The Israeli military said in a statement that soldiers had, quote, fired warning shots after thousands of Gazans gathered in the area. It also said the reported number of casualties did not align with its own initial review. Joining us now, Head of Communications and Public Affairs for the U.S. and Canadian Division of the International Red Cross, Steve Dorsey. Steve, I know your organization has been working there. What's the latest you've heard? Because it wasn't just yesterday. There's been a string of reported attacks in recent days on Palestinians who were simply trying to get humanitarian aid, who were simply trying to get food and water for their families. Reports of attacks from the Israeli military.
Jonathan, I think these mounting incidents we've been seeing throughout Gaza, not only in North Gaza, but also in the south in Rafah, where we operate a field hospital, are just the latest examples of how common it is to count the dead in Gaza. The entire enclave has become a horror show. More than 2 million people's lives have been turned inside out. And of course, on the ground, our teams are dealing with now dozens of mass casualty events since this new aid mechanism was put in place in May. We've had 3,400 people visit our facility in critical need of care for injuries from weapons. We've also seen gunshot wounds, the majority of those cases, along with shrapnel injuries. It's overwhelming not only our hospital there, but also the very few remaining healthcare facilities that are left standing in Gaza.
Steve, how are you managing that? And I know normally the Red Cross can sort of count on parties abiding by rules where we're protecting the Red Cross, protecting the injured, not going after a convoy that's providing food relief. And so, how do you, just as a practical matter, deal with that when it comes to hospitals and providing care when you're trying to protect your people as well as get services made? And you can't count on protection.
Yeah, we try to make clear that civilians in conflicts, not just in Gaza, but anywhere in the world, often bear the biggest brunt of the devastating effects of war. We talk privately with all sides involved, in this case, of course, Hamas, but also with Israel and with anyone in any party in any state that has influence on the outcomes of the fighting. You mentioned Red Cross workers. You mentioned protections for them. Just since the start of this conflict in Gaza, 6 of our own staff members have been killed. The latest one just this month. We haven't been able to retrieve his body just yet. And that just goes to show how dangerous it is, even for the people like us and across the humanitarian sector, to get aid to people that need it. And we should remind everyone involved here that civilians should not be risking their lives to reach food for themselves, food for their families. It should not be chaos and desperation. And it's not just food that these people need. They need fuel, which is running out at critical levels across Gaza, including at our own hospital. They also need components for critical infrastructure systems like power, and they also need clean drinking water. Those are all essential to civilians across this conflict.
It's just a devastating scene, Pablo. We've heard people talking about it for quite some time. Gazans on the brink of famine. And anytime you talk about stories like this over the past 6 months, people have said, oh, that's just Hamas propaganda. That's not. No. This is the United Nations convoy that said their relief convoy to bring food to starving people was attacked by Israeli tanks and Israeli gunfire. It's the International Red Cross that's saying it, the Red Crescent that's saying it. Outside, because the media is not allowed to go into most of these zones, but it's international relief organizations that are reporting that they are under attack, and it continues. And just the question is, when is it going to stop? When are these relief these areas where they're supposed to get relief for their starving families? When are they going to stop getting killed just for trying to get food to keep their families alive?
Yeah, I think it's important to see this, as you put it, also through the lens of just media literacy and who we trust and who we consider a reliable narrator. Because if you don't trust the Red Cross, Joe, I actually want to ask this as a question to Steve. You know, the tonnage here, right? The statistics, Joe held up the front page of the New York Times above the fold. All of these numbers, the data, the facts. What to you is most disturbing about the way that the American public writ large is or is not reacting to what feels like just objective, down the middle, unbiased reporting about the toll of human suffering that you've been, of course, encountering and that you've been trying to tell people about?
Pablo, I think it's a little bit of complacency, but it's more about becoming more comfortable with watching humanity being put to a breaking point. We see this, of course, in Gaza, but listen, there are other horrendous conflicts around the world where millions of people are at risk of death. And we're talking about the crisis in Sudan, in the Congo, of course, in Ukraine as well, in Yemen. These are all areas where, as I said earlier, civilians are bearing the biggest brunt. Our job, not only at the Red Cross, but elsewhere in the humanitarian sector, is just to get help to people that need it. War is never something that should be impacting families, splitting them apart, forcing them to resort to desperate measures just to get food. This is something that we as a nation and as a world can no longer accept.
Head of Communications and Public Affairs for the U.S. and Canadian Division of the International Red Cross, Steve Dorsey. Thank you for being here, and thank you for your work. And